All right, I would like to officially welcome everyone for attending today's Ides of March Heroin Task Force Quarterly Community Partners Meeting. And the first thing I want to point out is we have a new tagline to go with our logo. We had a lot of discussions at our Heroin Task Force Steering Committee whether or not we should keep our name as the Heroin Task Force, since we're dealing really with the opioid epidemic and other issues. We decided, since we had been around for a number of years, that we should keep Heroin Task Force as the name. But we had a very exciting steering committee meeting where we had 10 ideas that we ended up getting together into the tagline that you're seeing. The first line, working together, is what we're all hoping to do today. And then the second line is really a mini mission statement that we want to break the cycle of substance use. And then the third line is explaining how we're going to do it through community action and hope, exclamation mark, because you got to have hope to do this work, especially sadly with the number of fentanyl deaths and everything else that's going on. So you should start seeing that logo with the tagline. And if you're ever talking to someone new who doesn't know about the Heroin Task Force, I think the tagline is a good way to real simply, in an email or a conversation, explain what we're hoping to do here. We have a very good agenda today with two excellent speakers, and we have, thanks to Terry Phillips, set up opportunities for small group interaction. And I believe we're also piloting a polling toward
yeah, we're going to try something new today. Yes.
But the one thing that I want to highlight to everyone is you're going to hear about our 4 action teams that have really done a great job of getting out the ground, and they all have some things in 2022 that they're going to work on. And when you hear about those action teams, if any of you are not members of the action teams, we really hope you'll consider joining them, because the more people that we have involved, not just in these community partners meeting, but in our action teams, I believe that will be the greater chance of success for fulfilling our mission and reaching our goals. So again, welcome. I am happy to turn this over to Terry Phillips. I should have mentioned I am proud to be co-chair along with Mary Simon from Elevate. I am a county supervisor and chair of the Health and Human Services Board. So Terry, I think that's it from me. Take it away.
Sounds great. And welcome everybody. As Larry said, I'm Terry Phillips. I'm your facilitator for the day. I want to also introduce my co-facilitator and tech support, Librada Estrada, who is here for us in all ways tech. She is a fabulous. She is a good friend of mine as well as a colleague. So Librada, thanks for joining us today. We've already settled into our virtual space, so I'm going to go right past that one. And just a couple of quick things. Most of you at this point, 2 years into our excitement of getting into virtual meetings, we all pretty much know where our mute button is. And I'd ask you to keep yourself muted just to take out background noise for now. And then if we have questions and what have you, we'll of course, have you on mute when you're in your small groups. We would love to see your faces. If you have the bandwidth to start your video, that would be excellent. Pop things that are coming to your mind into chat. Please feel free to do that. There's a reaction button as well. And if you don't have the this little smiley face. You might have a dot, dot, dot and have to click more to find it, but feel free if something is sounding good to you, a thumbs up or a heart or whatever you would like to do. And that is also where your hand raising feature is. So because we have so many people in the virtual meeting, that would be a great way to ask some questions. So thank you for your patience on that. And this isn't, we've done this each time, so I'm going to kind of breeze through our virtual workshop guidelines. Use the hand raise feature if you can. We talked about the mute. Turn off your other devices, which I forgot to do, so now mine is off. We ask you to be fully present. We're going to keep you here. We're going to try to end at 4:30 promptly. As you know, that's what we target. So we will promise to do that. Be mindful of your airtime. There are a lot of us on the call and many want to be heard. So let's be mindful of that. And then when you're done with your statement or comment, you can just say, I'm complete, or I'm done, I'm finished. And then we know we can go on to the next person. So briefly, you guys have the agenda. We're going to do a little bit of context setting. We're going to do brief action team updates. As Larry said, we sent out an update for each action team. And on that update is a contact information for all of the leads for every action team. So if there's an action team that is intriguing you and you want to get involved, please contact that action team directly. But today we're really going to focus, we have two wonderful, wonderful speakers, Sean Doyne and Paige Andrews will be joining us, and we'll do a proper introduction in a little bit. But they're going to focus on what other data tools, best practices, and strategies are available to battle the opioid epidemic. So we're really thrilled to have them here today. And then we're going to break up into some small group to talk about the implications of the information that they shared with us today, and then just some final reflections and next steps. So that's what we're after. And of course, we want to continue to re-engage as community partners, hear from our action teams, and continue to build a shared understanding of other strategies that are available to your agencies as well as to us as community partners. This has not changed. This is our vision to reduce the impact of the opioid epidemic in our county through implementing a collective community approach in 4 priority areas: prevention, harm reduction, treatment and recovery, and data and reporting. And today is focus question. I've already popped off to you today, so we're all good to go there. So this is just a summary of our last few shared learning opportunities. And we do have videos and slide decks from these. So if those of you who weren't able to join us back in September or December are interested in this information, we can always give you a link to a video and the slide deck. But in September, we started hearing from Paul Krupski, who's the Director of Opioid Initiatives here in Wisconsin. So we got the big global statewide look. In December, we got our county look. So Chris Clens from the ME's office, the medical examiner's office, was here sharing information, as well as Captain Casta, who's on the call today, about what's going on, you know, on the streets, if you will. And then today we've got Paige and Sean joining us from the North Central High Intensity Drug Trafficking Area, the HIDA. And they're going to be giving us some additional best practices and strategies and data tools that we might be able to use. So we've got the agenda set. The only thing I want to call and draw your attention to is that the official end of the meeting is 4:30. However, we are going to have a little 30-minute extra breakout session if you want to stay. So imagine at the end of your conference, you want to go up to the speakers and talk to the speakers a little bit. Well, here's your opportunity. Paige and Sean are going to hang with us for 30 minutes, and we're going to create a breakout room so you can ask some additional questions of them. We're also, Ashley's not on the call just yet, but Ashley Nowakowski from Your Choice to Live and recent brand new author of a book called The Shadow Child is going to be sharing her journey as a sibling of someone who had a substance use disorder. And she is, again, a new author, so she's going to share a little bit about her book. And then if there's anything else you all want to talk about, we can create a breakout room and you will be allowed to self-select into whichever room you want to learn a little bit more. So we invite you to stay if you can. And again, as each time we do this, I want to really show my gratitude to my breakout room facilitators. They're taking notes for us on the Google Slides and doing some light facilitation. So I want to thank all of you again. If there's anybody else who's comfortable with Google, has a second screen because it makes it easier, let me know so we can spread out who's having to do the breakout rooms each time. And again, welcome to Librata for joining us today. So we are going to go right into our brief action team updates. And action team chairs, I've briefed you, but we're going to ask for a very brief 2-minute update. Everyone has the updates. So again, this is a brief update. And again, if there's something you're interested in joining or getting more engaged in, please reach out to these chairs. We have 4 action teams going, and here are the chairs, and they are listed on that action team update. And we are actually going to start with Mary Simon and Jake Jansen from the prevention team, and they're going to share a little bit about what's happened since December and what their next steps are. And I'm actually going to stop sharing so we can, I don't think, we don't have any slides for you. So we're going to just introduce you guys, and I'm going to pin you, I think, and spotlight you while you're speaking, Mary, if that's okay.
Yep, that's fine. So we are really excited. Prevention Action Team has been meeting. Our overall goal for our Prevention Action Team is really focused on education and trying to continue to educate the community about opiates and heroin in our community. We have our first presentation scheduled for April 6th. It is focused on seniors because if you did not know this, you should know that seniors are the highest population. People over the age of 65 are the highest population that have used prescribed pain medications in the last year. And so we really wanted to focus in on that population and educate their caretakers about opiates. And so our presentation is April 6th. We're going to have 3 speakers. It's a virtual presentation. We're going to have a psychologist. We're going to have a pharmacist, and we're going to have a physical therapist talking. Physical therapist will focus on the alternatives to using medications to manage pain. The psychologist is going to focus on how opiates, the pharmacist is going to focus on how opiates impact on the brain and why do they work. And then the psychologist is going to focus on if you are a caretaker and you are concerned about someone's use of medications, how do you have that very difficult conversation with them? So we need help in promoting this event and getting it out there. We'll have a flyer and that will get shared with everybody. But that's what the Prevention Action Team, our plan is to continue to do some of these other presentations with other populations, but this is our first kickoff one, so we're really excited.
Great, Mary. Thank you so much. So Librata has put the contact information for this team. We'll be pushing out their flyer to the full Heroin Task Force email distribution list. And then we'll ask you to push it out to your community partners and contacts. Thanks, Mary, so much. And Susie, I'm going to move to you and your team, a harm reduction team. And I will spotlight you as well, Susie, if that's okay.
Yeah, that's fine. Good afternoon, everyone. Harm reduction team, we're very excited about what we're doing. And all of us believe on this team that this is not the most popular area to be in, that it gets to the guts of the problem. What we've learned since we've started is we have to incorporate recovering people into our team. We've had listening sessions with people in recovery in different phases of recovery, and it's kind of changed our perspective a little bit on how we're moving forward. We've started a campaign called the Never Use Alone campaign. There is a link in our report that you can click on it. Getting these cards out to everybody is very important. What we learned in the listening session was that our people that were out there would have used this, and it can save many, many lives. In fact, 2 people actually went online to volunteer to be a phone operator. So we've got this started up and running. We just need to get the information out there to everyone. Nalox boxes, These are boxes that people can take Narcan out of, and we will replace them. We're in the process. Wisconsin Voices for Recovery is also going to be helping us. They're going to be giving us the boxes and supplying the Narcan. So we'll be placing them in areas around the city. We don't need to do the Alano Club or the Lake Area Club because they have Narcan training once a month and they have supplies of Narcan for everyone. So they're covered. We're looking at places where people who use drugs are often hanging out. So Department DOC, Randy, you're probably on here. They are also going to be receiving the lax boxes. This is something new that's just come down and not too long ago, and we're excited about the fact that Narcan is available for everyone. One thing else we learned from our listening section is putting together a small fact sheet for people that are out there with these numbers on, with numbers to help, just so they have it. And we also learned that peer support is incredibly important. We actually have kind of some exciting news that Department of Corrections will be funding a peer specialist from out of WCS, our building here, and be working with people in corrections. So we're starting to move that ball a little bit, which is extremely important. We have long-term goals. I'm not going to go into the Worth program because it's a long program and it involves a lot of community members to get this started. If anybody is excited and anxious to get on our team, we would love to have you. How's that for timing?
That's perfect, Susie. Thank you so much. I'm going to unspotlight you there. Thank you so much. And again, Librata and I've been dropping some things into the chat. All of this is on the action team updates and more to come on that Worth program that Susie was alluding to. If you're interested, definitely reach out to this team. And I'm going to move on to treatment and recovery. And I'm not sure if it's Chris, Colleen, or Sarah who is going to speak for us today for this team. I'm going to pause on that team.
I could talk.
Fantastic. Fantastic.
So what we've been working on is trying to figure out a way to possibly bring MAT into the jail. So kind of what we're doing right now is just more of like education for our team. We're going to try next time that we meet, we're going to have a representative from Milwaukee County Jail come and talk about their program. We're also seeing if we can find another county who's doing it to give us more information. We've also asked John Kettler to come to our next meeting to provide us some information with information he had regarding possibly having this type of program in the jail that he worked at a couple of years ago. So we're kind of in the education and searching for more ideas on how to put this together. We're also interested in putting some kind of resource guide out for people to get drug and alcohol treatment resources, and then how to kind of navigate how to find resources, because that seems to be a problem. One of the barriers that we found in Waukesha County, or that we discussed in Waukesha County, is people getting transportation when they don't live on a bus system. So we've been talking about how we can provide some transportation to the outlying cities in the county. So that's where we're at.
Fantastic. Thank you, Sarah. I really appreciate you popping in. Thanks for that.
Yep.
And the last team is our data and reporting team. And Felicia, I know you're on, Adele's on. I don't think Jerry's on, so I'm not sure who's reporting for your team.
I think Adele is.
Okay, fantastic.
Thanks, Felicia. I will remember this next week. We have our we are meeting next week. For those of you who are really want to engage in the data right away, we are all about the numbers. We dig in and try and find where the data is, not only for the other action teams to do their work, but also for the steering committee as well, kind of as an overall heroin task force. What numbers are we looking at? Probably our biggest undertaking is how do we organize all this data that is out there? So not only when we find it, it's going to be how do we organize it, and then how do we make it accessible for people, not only working with the task force, but just kind of working with your own agencies or on your own programs. So we have that as kind of a big picture. The little picture, what we kind of do the data dives is specifically kind of the data points. And so we're really thrilled to have another speaker this month, or I should say this meeting, about data, so we can start looking at the very specific data points that affect our work. The other option, or I said the other project that we're working on, is bringing back the overdose fatality review team. So we talked about that as a steering committee level this past week, and we're going to be bringing that back so that we can look at some of that strategic data and looking at preventing more overdoses.
Great, Adele, thank you. And I know they were super excited to hear from Sean and Paige. So they're excited to hear your presentation. Also, this team is supporting data, helping the other action teams identify data sources. They're helping them with creating evaluation forms, or questions for their sessions. For example, the prevention team session, I know they're going to look to this data team to help draft some questions for the like a pre-survey and a post-survey type of thing. So this team is, I think this is what's differentiating us maybe this time from the last time we went around and did this. We've got a data and reporting team that can help drive the work of the action teams. So I'm going to pause. We have a couple of minutes. Is there any question or anything that anyone wants to raise that needs to be addressed, or are we good to move on? Okay, fantastic. All right, so I thank you, action team chairs, and all of you who are serving on the action teams. If you can look through the report, you can see there's quite a few people who are involved in each of these action teams. So again, as Larry mentioned at the start of the meeting, if you are interested, please contact those chairs, and we would love to have you join us. So I am going to shift back into a screen share mode, and we are going to head into our speakers. But before we head into our speakers, we're trying something new here. So I'd like all of you to grab your phone. I'm assuming everybody's got a phone. I've got sun coming in. This is a good thing. I've got sun coming in, but it's there. All right, so I'm going to have 3 questions teed up for you, and I'm going to talk you through how to make this happen. So fingers crossed that technology is my friend today. All right, so you can open your phone, and get it to, like, as if you're going to take a picture. Our younger people are already knowing what to do. Hold it up to the barcode, and it will prompt a website for you, and it will take you into our first question, and you can answer the question. If you can't, if your barcode, if that QR code is not being read, you can also go to slido.com. Just open on your phone a browser and go to slido.com and type in that code, and you can answer the question. So you can see some of us are starting to answer. We've got 17 people. Is there anyone who's like dying, like, I can't do this? Is that, do we need some help? All right, so the first question while you're answering it is, do you feel like you have access to the appropriate data to aid in decision making? So they weren't ordered this way, but they're flipping based on your answers. One was, yeah, I'm great to go. I've got pretty much everything I need. The second answer was, you know what? No, I wish I had more information available to me. And the third was, I think I'm somewhere in between. I have some data, but I wish I knew where to access additional information to support our work. So I'm going to give you about 10, 15 more seconds if anybody else wants to answer this one. And most of us are landing, 70% of us are landing, I'm somewhere in between. I have some data, but I wish I knew where to access additional information. This is also helping our speakers, I know, as Sean and Paige are nodding their head. All right, I'm going to move on to the next question. I did practice this yesterday. The next question, just look at your phone. It should have gone right to the next question, and this is an open-ended answer. What data do you use in your agency to make decisions? Now, I know you are not all in agencies, but if you are affiliated with another program or another coalition, if you can think about those types of things, we'll think about that. So we'll see what happens here. Are you guys seeing the question? Okay. Nothing's coming up yet. Oh, here we go. Assessment results. And I will summarize all this. Medical examiners reports, hospital alerts, prevalence of use, DHS data boards, substance use rate, overdose rates, mental health conditions, ME's office data, HHS, Wisconsin, number of drug tests, number of people using different substances, youth risk behavior survey data. I'm trying to get that right now for our county. CHNAs, needs assessments, epidemiology reports, a lot of medical examiner reports, data from Waukesha County HHS, county reports, ME's office, YRBS. YRBS is the Youth Risk Behavior Survey. Okay, I'm going to give it another couple of seconds in case anybody else wants to add. So a lot of this is pretty much local data. And again, this is going to help Sean and Paige. All right, the last question. Again, it should be on your phone. It should flip right to it. What information or data do you wish you had access to? What else are you looking for? And Librada, are we doing okay? I haven't checked chat or anything.
Nothing's come up yet, so folks are fine as far as I can tell.
Great. Sarah, honestly, it's not only young people who understand QR codes. That's great. It was so funny. All the young people immediately took their phone. They knew exactly what to do. All right, so data to guide treatment, more local data, BIPOC data, more local data. Hang on, let me get back up here and scroll down a little bit. Number of people saved by Narcan. School level data across all programs, disaggregated data to ensure equity, whatever law enforcement can provide to us. Local data, data on youth, that youth data, okay, comprehensive, I am working on that. Believe me, I am working on trying to get this YRBS. Ben Jones, our public health officer, has been on this. There's a long story attached to that. The bottom line, we have to have a certain percentage of high schools running the survey in order for us to have county-wide data as opposed to just district-wide data. County level data, it is generally delayed. Oops, I'm scrolling down here. Geolocation of arrests and or emergency calls for overdoses. Data from Waukesha County's benchmark counties. And I believe our data team is aware of those benchmark counties because, yep, okay. What has worked well in comparable communities to have an impact on opioid overdoses? And then we've talked about the local youth data. Well, this is certainly teed up our information for our speakers. So I am going to stop sharing. Trying to do 15 things here at one time. Sean and Paige, I'm hoping that helps you a little bit before we move to you. I'm going to introduce Sean and Paige, but I'm also going to ask them to do a further in-depth introduction because they both have extremely interesting backgrounds. Our first speaker is Paige Andrews, who is, again, as I mentioned, they are both with the North Central High Intensity Drug Trafficking Area, HIDTA. She is a public health analyst for this team. And Sean is the Wisconsin Overdose Response Strategy Drug Intelligence Officer. But both of them have extremely interesting backgrounds prior to this that have brought them here today. And they work as a team in our state. And with that, I'm actually going to turn it right to you guys so you can take it from here. Great.
Perfect. Good afternoon again, everyone. I'd like to thank the leadership team, first of all, for affording us this opportunity to present some of the data and some of the things that we've learned. You guys are definitely on the right track, listening some of the comments and what the action team updates were. That was very interesting. One of those points was, being a little bit more inclusive as far as recovery, persons that are recovering, and getting their point of view. It's a big part of what we do. Is Paige and I have different viewpoints, and I think a lot of it is understanding each other's perspective. So from the law enforcement and the public health side, we kind of sometimes meet in the middle, but it's good to understand the other perspective. So again, I'm Sean Doyne. I'm the Drug Intelligence Officer for North Central High Intensity Drug Trafficking Area. Don't let the drug trafficking piece necessarily scare you off. That's a piece of it. That's more of the enforcement. We're part of the overdose response strategy, which we'll talk about a little bit more in depth. My background, I retired in September from the Milwaukee Police Department. I was there 26 years, retired as a captain. In that capacity, commander of the Forensics Division, commander of the Violent Crime Division, which in Milwaukee's, there's a lot there. I think we were averaging like 800 non-fatal shootings a year, so pretty busy. Prior to that, worked homicide, also worked at HIDTA for 3 years as a group supervisor for a DEA task force, and pretty much anything else related to patrol and the Criminal Investigation Bureau. I've had a piece in or worked in the past. Side point, also retired from the National Guard, 28 years. I was an intelligence officer, commanded the company in Wisconsin for the Army. So yeah, really a diverse background, and I'm currently, I'd like to joke about this, I'm studying for my honorary PhD in epidemiology, and Paige is my mentor. So Paige is kind of steering the ship here, but yeah, we make a great team, and I really appreciate it. And to you, Paige.
Thanks, Sean. Yeah, good afternoon, everyone. And thank you again for having us here today. As Sean mentioned, my name is Paige Andrews. I'm the Overdose Response Strategy Public Health Analyst for Wisconsin. And in a minute, we'll kind of better explain how we fit into the overdose response strategy in the big picture. I actually work for the CDC Foundation and support both the North Central HIDTA and the Wisconsin DHS in my great work with Sean. He's a wonderful partner. Prior to this, my background is in epidemiology. I'm also currently actually working on my PhD in epidemiology, but fingers crossed, it's kind of a long road. Then before that, I've worked a lot in various violence and prevention efforts and emergency response in public health, both at the local, state, and federal level, and have a bit of experience in some harm reduction agencies in New York City that I've really loved. So that's what we're coming with today, and we're excited to share what we have.
Here's what we're going to cover today. We'll do a brief explanation of what the overdose response strategy is. And we're going to go into overdose related data, fatal overdoses, non-fatal, and drug information, substance use, as well as treatment and support. And then we'll follow up with that is using that data to prevent overdoses. And we'll look at it on 3 levels: immediate interventions, which are almost like a spike alert, what the response would be, follow-up support, and then strategic planning. Next slide.
So as we both mentioned, we're part of the overdose response strategy. And so a lot of people aren't familiar with this program, so we wanted to give a quick, brief overview of what it is. So essentially the whole idea behind the overdose response strategy, we call the ORS, is that it takes multiple sectors to fight the overdose epidemic. Specifically, public health and public safety need to come together and figure out how to solve this problem. And so this model really starts at the federal level. So the Centers for Disease Control and Prevention and the ONDCP, which is the Office of National Drug Control Policy, kind of work together to form the overdose response strategy, which is where Sean and I both work. And so how that looks is that on every single state in the country, there's one of each of us. So there's a public health analyst, myself, and the drug intelligence officer, Sean, who work together and fill whatever needs or gaps are at that state. And so we primarily work at the state level. Again, I heavily support the Wisconsin Department of Health Services, and Sean heavily supports North Central HIDA, but we do a lot of crossover and work on most projects together, as well as state partners, other state partners and other local partners where needs arise. We especially try to target local interventions where overdose rates are the highest. So we do a lot of work in Milwaukee County, for example, and we're really excited to spend this time with you today on any follow-up that may come from it. So if you have any questions about the ORS and kind of the work, we'll be happy to answer that in the breakout at the end of the session time today. So this is the ORS mission statement. We just try to reference it every once in a while as it helps guide the work that we and our colleagues across the nation do. And really the ORS is focused on sharing information and supporting evidence-based interventions. And so that's kind of exactly what we wanted to do with you all today, is kind of just share what overdose information we found helpful and available for Wisconsin specifically, and then sharing the evidence-based interventions in Wisconsin and otherwise that have been working or can work here potentially. And just as a little bit of background, when we were originally introduced to your wonderful leadership team, they asked if you'd be willing to kind of present an overview of ODMAP, which is a surveillance system that's used for overdoses across the country. And then kind of in our discussion, we realized that it might be helpful to start with just kind of this landscape view of what data and response options are available. And if upon further thought and reflection from our time together today, if we would do a deeper dive into a certain topic such as ODMAP or another system, we'd be happy to come back and do that as well. So before we dive in to the data tools that we wanted to share with you today, these are all main takeaways you wanted to review that all of you already mentioned in the original discussion. So it sounds like we are all on the same page. But we just wanted to note that a lot of the national and state level data sources that we're going to share do have a time delay. And that's because most of those are what we call confirmed overdoses. So those generally are associated with, complete case investigations or finalized toxicology reports. And there's just inherent delays in getting all of that information aggregated and redistributed to folks. So a lot of the sources do have that time lag. However, there's a lot of good things that can come from more quick reactions to changes in trends or emerging substances in overdose-related data. And really, all of that good information is mostly available at the local level. And a lot of that is around local data sharing and partnerships and figuring out how to best share that information to inform your practices. And so we can't, that is 100% what you guys are already doing and aiming to do. So, and we can't, do that ourselves. And so we're just here to help and share examples of what other folks have done that have been successful and be of any help it can be. And finally, we just wanted to reiterate that we have some examples, but there's no one way that's best to share information. For example, we're going to share a dashboard that we helped create for Milwaukee County, but we never want perfection. Not that that is perfect by any means, but we never want perfection to be the enemy of good. And so anything that can be done to share information to inform programs, we consider a gold star in our book. John, is there anything you want to add before we jump into our table?
Good.
All right, sounds good. So we hope we don't give you too much whiplash, but we're going to kind of jump between these data sources and what they look like as we work through them. And all of these sources that we have listed that are underlined are all links. So we'll share these slides with you after the presentation. And we just hope that it can be a good resource, even though it sounds like from the data sources you're already reviewing, you know about most of these already. So we hope that this can still be helpful. But even just so, yeah, all of these are links, just so you know when we do share the slides. So we wanted to start with the bread and butter of fatal and non-fatal overdose data sources, and kind of go over the ones that we think could potentially be most helpful. So we've listed both national and state resources here in these first columns. We're not going to take time today just because we're a little time limited to go over the national data sources, but they are here in case you want to reference them. Especially, for example, I think we've all heard this awful statistic about how the nation saw a 30% increase in overdoses from 2020 to 2021. Information like that in the national map that you generally see related to that change in fatal overdose, that's going to be at this first data source, just in case people are familiar with that statistic and that source. This is a great resource to understand where those trends come from. But like I said, we're going to do a little bit of a dive into the state level information. The first one we're going to look at is this Wisconsin DHS dashboard about opioid deaths by county. I need to stop my share and then reshare here. So this is that first link. Can everyone see this okay? Did I do that all right, John?
Yep.
Okay, great, thank you. And if I ever start talking about a source that I don't have up on the screen, that just means I forgot to switch over, so please stop me. So again, a lot of the information available that's aggregated at the state level, like you mentioned, does have a delay and doesn't really get into sub-county information. But we still wanted to just share this in case it could be helpful. This dashboard, excuse me, just had to refresh for us there to make sure it's up to date. But so yes, if we look at Waukesha County, I'm sure you all are familiar, but this allows you to look at the recent trends for fatal overdoses in Waukesha. And then when you select it, it does tailor the demographic information below specific for opioid deaths for your county. This tool is only available at the statewide level. It looks at the green bars indicate that they are an above average amount of fatal opioid overdoses, and then the lighter bars are below average. And as you can see, recently we haven't been doing as well, which we all know, unfortunately, very dear to our hearts. But this is, again, isn't available in this dashboard for the county level. And when they say opioid deaths, it does specify up here. You can look at different types of opioids available. And you can look at both rate and count for the various years. I'm going to go back to our presentation. The next source of fatal information that we wanted to share, that's very similar. This is very similar to what we just shared, except not just opioids, but all drugs, as you're familiar with, but is the WISH query. Again, sorry, we're just going to be a little bit jumping back and forth. We weren't sure the best way to do this besides jumping back and forth. So please bear with us. Can everyone see WISH? Great. Yep. Okay.
Yep.
So for the WISH query, this is a little more customizable. Again, it's still at the county level, but this is where you can choose a metric that you're interested in. For example, if you want to compare Waukesha County to other areas, probably the age-adjusted mortality rate would be most useful. But we'll just look at number of deaths for this example and say we would like to learn about the number of fatal overdoses in Waukesha County involving heroin, just of unintentional or undetermined intent for Waukesha County. For all years available, all age and sex and race and ethnicity specifications here. And we'll go ahead and look at that by year. So this is really just a query tool that I think is a great way to kind of get county level information. Now, the reason why you see these X's here is because Wisconsin DHS has a suppression rule in place where if there's 5 or less overdoses, that count is suppressed for privacy of the decedent and their family. So that can sometimes be limiting when you're looking at more specific drug types, but this information still is available. And as Sean likes to point out, he always says that this jump from 2019 to 2020, really when we were looking across drug types, is pretty stark.
Mhm.
Okay, going back to our presentation. The next tool that we wanted to share is this Wisconsin DOC opioid overdose deaths and hospitalizations. So this is actually both fatal and non-fatal information. And when you click that link, it will bring you to this page. And so we wanted to show you the actual page where it comes from in case you would like to look at the report when it's updated and then the link when it updates. So if you scroll down and go to the drug-related offender reports and expand that and look at the opioid overdose report. This is from DOC, as we mentioned. And again, there's a bit of a delay, but we thought the information included in this report was really helpful at a bigger picture level. Especially Sean and I work a lot with folks who might be transitioning from a correctional facility. And this really demonstrates here that that 3-month window of transition back into the community is especially dangerous. And just information like that that can help inform efforts or maybe suggest areas to take a closer look at within Waukesha County to see if trends are comparable. So again, it does have some information on demographic variables and looks at regional differences. All right, we are just moving right along, so I will go back to the PowerPoint. One last thing that we wanted to emphasize about fatal overdose information available for Wisconsin is this email address. So I think sometimes it's great to reiterate that a lot of the information available does not mean it's the only information available. And DHS has lots of wonderful, talented folks who are able to receive data requests and get more customizable information for your county. If you want it at the zip code level or lower, based on different substance type or demographic categories, you can request that information from DHS and they can work with you to get anything approved by their data governance board that needs to get approved, or just, whatever that needs to happen to make sure data privacy restrictions are in place. They will do that and help you. And so they are a great resource that I just wanted to note as well. All right, so we're going to transition to non-fatal overdose information. So we just finished this block. Now we're going to move to this block. Very similar to the fatal dashboard that we showed is the non-fatal dashboard. And that really focuses on opioid hospital visits. So traditionally, non-fatal overdose information really comes from 2 sources. You have hospital and you have EMS service runs. So this first one is hospital. And again, this is pretty much identical to the fatal dashboard. So similarly, you can select Waukesha County. It likes to refresh on me, apologies. To look at those trends over time and understand how that varies by demographic variables. For the same substances that we discussed earlier, again, rate and count are available. Something I also want to highlight is this difference between emergency room and inpatient. So both are available, and emergency room really captures anyone who might present to the emergency room with an overdose. And this is really the intake database, if you will. So if folks are familiar with Essence, which we'll get into a little bit later, that is mostly emergency room visit type. And now if someone goes to the emergency room and then is admitted, then they become inpatient. And so that's kind of the difference. And so that's an important distinction sometimes, because if you look at both data sets at once, there can be duplicate folks who were first in the emergency room and then admitted. So they just provide both here because it depends on what you're looking for. All right. Coming back, this next one then, if we just reviewed the hospital, Now we're going to look at EMS data sources available at the state level. And so for that, the link will bring you to this page. Again, I want to show you how to get to these reports. If we scroll down from the dose of reality opioids data, if we want to look at EMS information, we want to come here to the monthly suspected opioid overdose reports. And then this southeastern region includes Waukesha. And this is going to be based on suspected opioid overdose EMS runs for the county, well, for the region. So this first page is the, well, here's Waukesha County right here. Normally I have to scroll all the way down. So this has very similar information to the emergency department dashboard. This one is not interactive, but it's because we're looking at EMS information, not emergency department information or inpatient information. And it's just another great source to compare trends over time. Again, this is the most recent and it only goes through January, so there is a bit of a lag. The next thing we wanted to review in terms of national and state resources for non-fatal overdose are the weekly suspected opioid spike alerts. So you all might be familiar with these already. So what happens is every week, Essence data, which is the emergency department intake data, is reviewed every county is reviewed. And if there's a statistically significant increase in suspected opioid overdose visits within that county, then this alert is generated and sent to the county health officer for your county. And then it's up to them to then distribute more widely. And we're working on that. There's a pilot that actually Kenosha is about to begin as well, to expand that to look at other ways such as daily and wider audiences. But right now, the statewide level is this weekly suspected opioid spike alert. And so I just wanted to share a version, an alert that went out. There's so many windows up with this process, so I apologize. Here she is. So this was the latest, as far as I know, Waukesha County suspected opioid alert that did go out last September. So as you can see, there's not a ton of information on these as either. Really what you just see are these are weekly counts of suspected opioid visits that come to the emergency department for Waukesha County. And the reason it went out is because there were 2 weeks that were rather high and did breach that significance level of 0.05 for unusual amount of opioid overdoses presenting to the emergency department. So this will go out whenever that occurs. And this is ongoing. Okay. Where's the button? There. And then finally, again, just really wanted to emphasize there's so much more information available than just these dashboards at the state level that can be shared. So here's another great email address that can be contacted with data requests for any further breakdown of this information, and they will work with you to figure out everything that they can give you to meet what you are trying to do. And that is right here. We also wanted to mention that this does not exist yet, but many states in the country have a statewide suspected overdose system where folks can log in and see near real-time overdoses happening for both surveillance functionality and alert functionality. Wisconsin does not currently have that right now, but they were just awarded $1 million through 2025 to build this system. And so it's still very much early in the process, but it has started, the ball is rolling, and this will be coming for everyone across the state eventually. And so that is also something to keep in mind that will be coming everyone's way. Now, to have an example of how this can happen at the local level, we wanted to share the Milwaukee County Overdose Dashboard that Sean and I just helped launch. It was just launched last month, and kind of shows what this information can look like when local and county level data sharing agreements are in place. So this has a lot of text to start you off, but then we get into the dashboard here. Can everyone see this okay? Great. So again, this is from Milwaukee County, but that's just who we partnered with most recently. And this is just really the first version of this dashboard. We hope to improve it moving forward. But what this really shows you is there a way to, that number is a little bit cut off for you, so I apologize, but this provides kind of an overview of the count of suspected overdoses by zip code and fatal overdoses by zip code for Milwaukee County, and you can toggle to the date range that you are interested in. It also starts you off with some overview counts for year to date in the last previous full year. And then it also walks you through various time trends and demographic information. Obviously, I won't go into too much detail with you today, but it does allow, you can explore further, and we're happy to answer questions about it for a deeper dive in both non-fatal and fatal overdoses. And how this dashboard was populated was it comes from the Milwaukee County Office of Emergency Management. So they have all of their EMS agencies feed their EMS service runs into their data hub, and then they share that. And the medical examiner's office in Milwaukee County for all the fatal time trends here, including substances involved and various demographic information. Another option is always ODMAP. So ODMAP is a national surveillance software system designed for overdoses. It is free to use and is really only as good as the data you put into it. And so there are lots of different ways you can enter overdose information data into ODMAP. For example, in Minnesota, the primary way overdose information is entered is by law enforcement. Whereas in Michigan, EMS inputs their information into ODMAP. And in Montana, like Sean will mention, it's the coroner and medical examiners who really only input fatal overdoses. And so whatever information you provide into the ODMAP system, it maps it, and folks can determine areas that they're interested in and set spike alert thresholds. And so one of your sister counties that we were told about is Dakota, Minnesota. And so something that they do with ODMAP, am I sharing my presentation?
Yep.
Okay,
good.
One of the things they do with ODMAP is what they really use it for this particular county is weekly snapshots. So this is an example of a weekly snapshot that they receive from ODMAP, and law enforcement uses it every week to review kind of what's been happening in their area and where they might need to send resources. And they also recently used ODMAP to decide whether or not to join the opioid lawsuit settlement, things like that. And then Sean, I think you wanted to share a quick example from Montana.
Yeah, a real simple example from Montana. They're just starting out with ODMAP. They decide they're going to look at not at fatal overdoses first. So right now, statewide, the medical examiners and coroners are entering those overdoses, the ODMAP. And then they're going back after the toxicology comes back and basically updating that. So what that does is it gives them really pretty close to a real-time surveillance system for fatal overdoses. Typically, I mean, if they enter within 24 hours, it's going to be on the map. So really the benefit of ODMAP is it's pretty close to real time, which obviously that's almost like the gold standard if you're going to use it to, I guess, direct resources. So that's a really good one. And I think that's one that could be easily adapted. Let's just take, for example, if Waukesha County did that, you'd have a pretty good, I guess, visual of your fatal overdoses. You could filter it by time range and by substance, different things like that in the back end and in the second part of ODMAP. So there are ways you can start it. They're very simple. They'll maybe give you better than what you already have. So it's definitely something to think about.
Thanks, Sean.
And ODMAP is free, by the way, too. So it's not, there's no cost to it.
I was trying to advance the slide. Okay. The next sources of overdose-related data we wanted to share center around drug information, substance use. And so we wanted to share a couple reports. So the first one is the Wisconsin State Crime Lab information. So if we go back to our other tab here, when you go to that link, this is where it'll bring you. So again, this is only at the county level, which I know can be a little limiting, but we really think this dashboard is great because of the plethora. Oh, I'm sorry. I tried to pre-populate all these links, but obviously the time lag is making us reload. But it really does give you so many options of drug types to look at, which we just think is really wonderful. Sean, though, likes to mention the important caveat of the State Crime Lab.
And it is somewhat limited because the State Crime Lab doesn't test every substance that's recovered. These are only cases that are going to trial. So it'd be drug recovery in a case. So it's somewhat limiting, but it at least gives somewhat of a trend. And you can kind of see trends even with that limited data set, but there are limitations to it.
Definitely. And it does provide kind of the same trend information per substance type as the DHS opioid death and hospitalization dashboards. Another great data source that we wanted to highlight that we really think is great is this PDMP dashboard. So the PDMP stands for the Prescription Drug Monitoring Program, as I'm sure you are all familiar with. And so the PDMP dashboard is really meant to help prescribers understand when folks are being dispensed and filling controlled substance scripts. And so that can help, curtail doctor shopping or help prescribers make more informed choices about how to care for their patients. And so when you look at the controlled substance dispensing dashboard, you really can learn a lot. It's all normally by quarter. But this is a great map, but I'm going to scroll down. I hope I don't make anyone too dizzy, but you can really learn about what is being prescribed in your county. So for example, in Waukesha for the final quarter of last year, it looks like alprazolam accounted for 13%, or I'm sorry, that's gabapentin, accounted for 13% of prescriptions tied with amphetamine. So just kind of interesting to see how that changes over time. You can download this data and then make some pretty interesting trend lines, which we've done that can be really helpful. And you can either further understand per drug type who are filling these prescriptions in case that's useful for your work, if you want to do targeted provider outreach and things like that. Another great source for the PDMP, again, hope I'm not making anyone dizzy, comes around these law enforcement alerts. So by state statute, law enforcement are, I live in an air zone, so sorry for the airplane if you can hear that. State statute requires law enforcement to report to the PDMP in 3 instances. The first is when there might be a diverted or unlawful possession of a controlled substance. The second is when folks might encounter a fatal or non-fatal opioid overdose. And finally, if there's been a controlled substance that has been stolen. And so now adherence to that state mandate of requiring entry into the PDMP is not ubiquitous across the state. And we are constantly trying to work to increase awareness and education and make it easier for law enforcement to report. But you still can learn some things based on the information available. For example, this graph here, we sometimes like to use to help us understand, especially potential fatal overdoses here. And here's non-fatal and stolen. So we just think this is also a great tool.
So when talking about the stolen, it's really many times these substances will be reported as stolen. That allows them to get a second prescription. So they have to have a police report to do that. So a lot of times that'll be a technique that's used to get additional prescription medications.
Okay, I hope that you're Here it is. Okay. Somehow we got to the wrong slide. Are you seeing the overdose related data slide, Sean?
No, we're on the treatment and support slide, the table. Yep.
Okay, great. Thank you. So yes, and so the final tool we wanted to highlight at this kind of state level for drug information and substance use is another DOC report that we thought was really interesting. So again, if we go back to the same page that is linked before, but we scroll down to drug-related offender reports and then drug offender prison admission trends. Sorry, this is not, again, this is statewide, so this is not county specific, but we thought that it did raise some pretty good summaries that could be of interest in repeating at the county level or might provide information on trends regionally in the state that might be of use. And just shows some good questions that DOC themselves are trying to answer. So we wanted to share it. Let's go down. All right. For the sake of time, we weren't going to go over the other dashboards listed here around kind of more substance use trends. And these are great treatment and support dashboards as well, available for the state. But we wanted to link them here in case you were interested in going back and looking at them at a later point in time.
Moving to how to use this data to prevent overdoses. We'll start with immediate interventions. Those would be typical, like following a spike alert, something like that. Then follow up with support would be after that. And lastly is strategic planning, which really, I think the state level data is somewhat more directed at that piece of it, because the state data is always going to be, I guess, at the lowest level, the county. So anything below that would probably have to be something that's done more local. Next slide, please.
All right, so when we talk about immediate interventions that can be made with this information, again, this would really require that more near real time data that the state dashboards aren't really able to provide, and would take those county partnerships that you guys are already pursuing and using tools that are available, such as ODMAP or other type of system to inform. But one of a great thing that can come out of these more near real time systems are spike alerts. And so really spike alerts can act as a warning system that helps identify when there might be a cluster or a bad batch of overdoses that, if intervention, could prevent further harm from one of these incidents. And so there are several different ways a spike alert can inform immediate response that we wanted to review. The first one is really for resource preparation. So letting first responders and treatment providers and harm reduction services and hospitals know that they might need to have more naloxone on hand, more fentanyl test strips on hand than they would normally if they are experiencing a greater number of overdoses in the community. Just kind of letting folks know to keep their eye out and be prepared can be helpful during an alert for a spike alert time. Another one that is probably my favorite is really having targeted harm reduction practices. So especially things like mobile clinics can be really useful in a time like this. So if you can identify an area that's experiencing a spike in overdoses, and during the time when the spike is occurring, you can deploy resources such as naloxone and safe syringes and fentanyl test strips to the area that might be at need while the need is there. Another example of a spike alert effect can be public notification of bad batches. And so sometimes there's concern about this, will letting the public know about a bad batch increase drug seeking behavior is a common question that Sean and I get when we talk about this. And actually the opposite has been found true. So there's been no literature that shows that drug seeking behavior increases. And when a harm reduction agency that I'm sure you all are familiar with, 5 Health, looked at what people did when they learned that as a source of drug supply might have a higher level of fentanyl than they were accustomed to, they found that although this didn't necessarily prevent someone from using a drug that they were already intending to use, behaviors did change. So there were greater adherence to safe use practices, such as starting slow and making sure you're always using with a friend, that do reduce the risk of a fatal overdose. And so we think that it is a great idea if there is a bad batch identified, to let folks know, so that people who may be using drugs can be informed, as well as their loved ones who might want to, have naloxone on hand and make sure they check in with their loved ones more often.
I think
I'll
that's
turn it
really
over to
important.
Sean.
And I think it's really important because the bad batch, sometimes it could require more than the typical dose of naloxone or Narcan. And that's the trend we're really seeing, is these drugs become more potent, it's requiring more naloxone. And there's even bad batches that include particular substances that would not respond to naloxone, like xylazine is a good example. It's mixed in with fentanyl to create a longer lasting result similar to heroin. That's one where naloxone might not work. So it's important to, I guess, get this out to the public.
Another thing we wanted to share is another sister county that you all shared with us was Dane County. And Dane County actually has a very robust spike alert program. And we're happy to connect you with them if you want to learn more. But basically, they work with their law enforcement and their EMS and their medical examiner. Then when they see an increase in emergency department visits, for example, of suspected overdose events, they then confirm and look for any similarities with those other data contributors. So it doesn't necessarily require an ongoing relationship of data sharing, but when they use one data source and kind of see a sentinel event, they then confirm with other partners and try to see, hey, are we seeing anything different? Is there any common factors here that could indicate that there is a bad batch present in our area? And if they find yes to that question, then they issue a public spike alert. And you can actually sign up for that through email or text message on this site. So I'm signed up for it just because I like to kind of see what people are doing and learn. So I would encourage you to do so too if you'd be interested. And the information they have around their spike alerts are all very similarly branded, and the logos are consistent, and it's in multiple languages. And they've really just done a really good job trying to make this information accessible. So if that was something that other folks were interested in doing, I would really highly recommend connecting with their specific team who launched this effort. Okay. Here we go.
We're going to kind of try to speed this up a little bit because it looks like we're running a little short on time, but
Okay.
here's a couple examples of data-informed overdose responses and follow-up support. There are a few post-overdose outreach teams, and these are really two different ones. One's with EMS, the other one's with law enforcement. So the Milwaukee Overdose Response Initiative, they call it MORI. This actually includes 2 firefighters and 2 healthcare workers. So what they do essentially is the day after the overdose, they'll try to make contact with the person that overdosed and offer them specific resources, whatever those might be. Could be naloxone, now it could be fentanyl test strips. Some of their stats looks like from June 2019 to July 2020, they attempted to contact 774 individuals. They actually made contact with 404, and 156% engaged with them. So that was about 35%, which is actually pretty good. Obviously, there's challenges because of addresses and things like that aren't always accurate. So it's a lot of time spent trying to actually find people. The other one is the Madison Area Recovery Initiative, or MARI. This is a law enforcement diversion. So it is pre-arrest diversion. So certain low-level drug offenses or even property crimes, they would offer them, I guess, really an assessment, which they could take. And then if they follow that, they'd essentially have their charges dropped after 6 months. So a little bit different in that it's, I guess, more of a captive audience and there's a choice, so to speak. But they've had fairly good success too. Looks like 62% have completed the 6-month program. So they have 6 months in this program and then the charges are dropped. So that's, I guess that's like 62 out of 100 have successfully completed it. But they also use this, they can use the MARI program as just a referral. So outside of an arrest, they'll refer someone to MARI for access to resources. So it's a really good program, and it's worth taking a further look into. Next slide.
And then kind of that third category of longer term planning. So this is maybe where statewide sources could be more helpful, or just trends information in general, is really around where can resources be most helpful. So examples of strategically placing drug take back locations, or hosting community naloxone training events and distribution efforts. The fentanyl test strip legislation, I mean, I think that's expected to be signed by Governor Evers this week. And so that, will be a huge stride in our state catching up with federal law. And another example we had when working with the Dane County partners is we were talking with Wisconsin Voices for Recovery, and they were really looking for where should they open their next treatment clinic location, and they were using this trend data, these monthly reports, to really guide that decision-making process to try to put it where the need would be greatest.
Another example would be the naloxone boxes talked about earlier.
Yes, exactly.
Use data to figure out where to put those. And another interesting one we just heard of was the drug take back locations. One of the suburbs of Milwaukee, they're doing presentations to assisted living facilities and nursing homes, and offering them a resource to do a drug take back, because a lot of them weren't aware of it. And they're having some success with that. So that's another good example of this.
Mm-hmm. And finally, really using this information to make sure prevention and education campaigns are reaching folks in ways that helps them. And so, for example, in Connecticut, we thought that this was a really creative approach where they were looking at overdose incident rates and decided that there was an area that really needed, the most support. And so they actually looked up all the mailing addresses in this whole area, every single one, and they sent resource cards that had information about harm reduction and treatment and support services and recovery communities, mailed to everyone's door. And they targeted local businesses, including restaurants in the area, where they could put a little resource slip in their menus in case someone would encounter it that way. So really just using that to drive practices. Something that Sean really is passionate about too is kind of making sure things are culturally relevant. We're working on a couple of different education campaigns, and if you're targeting folks in their 50s, that's going to look a lot different than if you're targeting younger generations. And so making sure what you're doing is kind of matching up with what you want to happen. And then finally, I know that generally resources can kind of be, glanced over, but we actually really curated this list, and we love all of these resources so much. For example, this FAST toolkit here, they have templates for creating data use agreements between agencies at the county level to make data sharing safe and HIPAA protected and secure, so that everyone feels comfortable sharing that information. And this Ohio Community Response Plan template, they have examples of what community spike alerts could look like that you could tailor to fit your county's interests and need. And so we just really love all of these. We really encourage you to take a look, and we're happy to come back and talk more in depth about any of these. So not your typical resource slide, really check them out, they're wonderful. And that is all we have for you.
That is fantastic. So there were some questions that were coming in the chat, so I'm gonna go through those. Again, I'm gonna send all of this out to everybody. They'll send us their slide deck, and all of these resources are linked in the slide deck, and of course you'll have the recording as well. But let's go through the questions, if that's okay, Paige and Sean.
Sounds great.
All right, so I'm gonna actually remove the spotlight for a second here. So the first question comes from Andrew, and actually came kind of early on in the presentation, and I might actually ask him to expand a little bit just to make sure that we're getting the right context. He says the increase looks like it started in 2012. What happened that year? And Andrew, if you want to mute.
Good. Can you hear me?
Yep.
Okay. And I'm sorry. So I'm waiting for a response before I expand, but I certainly can expand. I was looking at the Michigan opioid resource page as well, and it seems to correlate 2012 and the gentleman, Kirk, I believe, related it to our Afghanistan foreign policy, which, that could be true or not, I'm not sure. But on the local level, from the reports you've read and the data you've looked at, I mean, does there seem to be a correlation to anything in particular, however strong it may be, to the opioid overdoses? It seems like, in particular, the synthetic version.
Yeah, so I think just based on, I mean, I'm definitely not, I don't know the exact answer for what was happening, but there's generally considered 3 waves of the opioid epidemic, and the fentanyl wave, the synthetic opioid wave, and the heroin wave. And so it's the first wave is prescription opioids, and then the second wave is considered heroin, then the third wave is considered synthetic opioids such as fentanyl, really being what's driving the deaths of opioid related overdoses in our country. And right around that 2012, I believe, is the heroin increase. I can find here. Just so I don't misquote you, let me send you the link to that CDC report that talks about these 3 waves and their suspected sources. If that would be helpful.
Paige, this is Kirk. I just to elaborate on so we were looking at factors at that time as well. I was involved in treatment services at that time. The Afghanistan component, when the Taliban were in control, they were suppressing the opium poppy farming. It was, so that negative aspect of them being there, but they were effectively suppressing the farming of the opium poppy, which is the raw materials that are used to create heroin. And so what had happened around 2012, 2013 is when the US and other countries started to draw down their troops, it created this economy gap in Afghanistan, and they went back to farming the opium poppy. And so that spiked from 2012, 2013, all the way up until 2017. We saw a record production of opium and then heroin. And the way it translated into the US and other countries, the UK, et cetera, was that heroin all of a sudden became very inexpensive. And it became less expensive than other drugs. It became less expensive than the prescription pain medications that were being purchased illicitly on the street. And so you saw people shifting from using opioid medications, illicitly to using heroin. That's what we saw at the time.
And I think that's really a result of a lot of laws that went into effect regarding prescribing. That was right in the middle of that time. The 30 oxys weren't able to be crushed up anymore. So if it's hard to get the legitimate medications on the black market, you're looking for another source, and that's when they moved into the heroin piece of it. So yeah, that's a great explanation.
Yeah, and that aligns with what happened in Waukesha County. If you look at our trends, you can see that when we saw from the ME's office. Thank you for that. And again, some of this is analyzing the data as opposed to just understanding what data. So if you can't answer it, don't feel, the next question is, does the EMS data include both fatal and non-fatal overdoses? Does it include if the same person is counted more than once?
That's a great question. So technically, yes, it would. EMS would include both non-fatal and fatal, but honestly, what we see much more often is that only non-fatal overdoses are included, because most of the time EMS agencies will be transporting a patient from their incident location to a hospital. And so then the outcome of that hospital visit is not, reflected in the EMS service report. If they arrive on scene and someone is not able to be revived, that would be counted as a fatal overdose in the record, but that would probably be the only instance where that's the case. And then in terms of multiple people, I believe was the second question. So if someone does experience multiple overdoses, right now the data at the state level is de-identified even when we see it. So we wouldn't be able to tell you with certainty that it was the same person. So it would just come as 2 separate events.
Great, thank you. The next question that came in is, how do they identify what the bad batches? how do they, I'm sorry, how do they notify the public of bad batches?
So Dane County has the email and text alert system. Everyone does it a bit differently. Some folks rely on media kind of bursts to do that. So I think it really depends on whatever that county thinks is best for their folks.
Okay, got it.
I think that really comes down to the partnerships that you have in place. So I think, you know, building partnerships now, those are going to be valuable when something like a spike happens. Be able to share that information. So building those partnerships is really the first step.
Great, thank you. Thanks, Sean. And the last question is, are fentanyl test strips widely available in Wisconsin?
That's a great question. Well, I mean, technically today they are in law, still considered paraphernalia, though that is expected to change very shortly. Then I think there's like I don't know what that, I should know this, but I think it's like maybe 30 days after a bill is signed before it goes into law. I think someone please correct me on that, but whatever that time period is, I think then DHS has plans to try to increase the availability of fentanyl test strips. But once that law changes, any like individual agency is more than welcome to acquire them on their own.
So that's a big deal that's coming across his desk.
That's a big deal,
Yep.
yeah.
All right, great. So folks, it is 4:27. Obviously, we're not going to go into breakout rooms, but if you want to just use the little hand raise, we're just going to debrief real quickly. I feel that as a team, we probably want to unpack this information at another time. There's so much good information, but as you listen to what Sean and Paige shared with us, what stood out to you? We'll just start with that. What stood out to you? And if you want to raise your hand, please do so. I'm also interested in, is this new information to you? Have you learned something new today? So the little hand raising feature is where the reaction button is, and just do a little hand raise or put a thumb up or something. So I know that you're, yep. Okay, Felicia.
Yeah, so I would say that a lot of the information is not new. Like I use a lot of those data sets on a regular basis, but what was the most interesting part was all the data dashboards where you're combining all of that data that I have to constantly click through, and the real life data I think is really important. I really like what Dane County and Milwaukee County is doing with that, because that's a great harm reduction and prevention strategy.
Great, thank you, Felicia. And Dr. Gill, I saw your hand go up and then go down. I wasn't sure if that meant you had a question or would like to add something.
That was an error.
If you want to share, you can. If you're not delivering a baby.
It's all great information for sure.
Okay, good, good. How about what else stood out to folks and what was new to you today? Let me ask the next question then. What are the implications for three things? You're working as an agency, or the action teams, or our county as a whole. So where do you see, what are the implications of the information that you've heard for the work that we are doing? So at an agency level, at an action team level, at a big Heroin Task Force community partner level. Yeah, Larry.
Well, to me, it just reinforces the importance of this Heroin Task Force. If it didn't exist, we would need to start from scratch. So the good news is we have the task force and the action teams. And I agree with you, it's going to take us a while to digest all this information and see how it could impact our work. So I just wanted to understand from Paige's answer on the fentanyl strips. A law was passed by the state legislature and we're just waiting for the governor's signature, because I know when the strips came up a while ago, they weren't available and they were illegal. So that's about to change in the near future.
Yes, it's expected to be signed by Governor Evers any day now.
Great, thank you. Thanks, Terry.
Great, great, no problem. Anybody else want a final word? I know we're at the 4:30 mark. I wanted to also invite our Kenosha friends. If people want to stay on, I want to invite our Kenosha friends to maybe share some of the work that they're doing. Before we do that, though, I just want to share my screen really quickly, and maybe Mary Simon, you can just help with the last few items before we leave for the day. So if folks want to stay, we can share a little bit more. So let me share my screen here real quickly.
Yep, and I just also want to give a shout out to Paige and to Sean. That was an awesome presentation. So thank you so much for your work and for being willing to share everything with us. As a reminder to everybody, we will get you this information via the slide deck and the recording. So you watch your emails. So it'll give you time to review those in your own time. Action teams are meeting. You heard a lot of excitement and exciting things happening with the action team. So please, we can always use more help with the action teams and getting some of the work done. And so consider joining an action team. There is a steering committee that's overseeing all of the work of the Heroin Task Force. So we just wanted you to know that there are some people behind the scenes trying to help steer where we're headed. So if you have input or ideas, I know Larry and I would be very open to those ideas and those thoughts. So feel free to reach out to Larry and I, and we can communicate with the steering committee. And then finally, we have 3 more community gatherings scheduled, one in June, one in September, one in December. Please mark your calendars and join us. And again, thank you everybody for coming. Hope we found it beneficial. I know I did. And again, a shout out to Sean and to Paige. Thank you so much.
Terrific, Mary. Thank you.
Yeah.
So for those of you who do have to leave, please do. And Paige and Sean are going to hang out with us for a little bit if anybody else wants to ask some additional questions. If our Kenosha friends are, and I know one of them, I chatted with her Jennifer when she first came on, but she has a sick child. So I also don't want to put her on the spot. But if you, oh, great. Would you mind sharing what Kenosha is doing?
Yeah, so the Kenosha Overdose Response Initiative is in its infancy. We had received the SAMHSA the FR CARA grant in September. And we now just have all of our staff hired. So I've been here for 5 weeks now. So we're very new to putting all of this together. So Paige and I have been on, as she stated before, about our overdose spike alert system that we are now going to be a pilot program for, or pilot county for. So really a lot of the things that we're doing is gathering information in order to create dashboards such as these and to make a overdose response initiative successful. We've met with Felicia and John at Waukesha, as well as Sarah Jesse at Sauk County, to kind of talk about, and I've talked to Greg Miller at Maury, as well as Mike Wright, who is the Maury creator, if you will. So we've had a lot of conversations with other counties and how they run their overdose response initiative. A lot of it under the grant writing, it's being able to provide resources and kind of mimicking what Maury does and how within a 48 to 72 hour period to make outreach to these victims and their families. So we just have to kind of put together how that's going to look since it's coming out of public health instead of coming out of EMS. So we are trying to figure out the best way and best practice to make sure that we're able to offer care as well as get folks attached to our crisis line and stuff like that as well to make sure that it's successful. So we want to make sure that the warm handoffs are good and that we have qualified people in place to drive the bus. So that's where we're at.
Great, Jennifer. Thank you for sharing. I was messaging back and forth with John Kettler, so I'm sorry I put you on the spot, but I think we probably have a lot to learn from each other, and I think there's a lot of valuable. It's really valuable for us to hang out.
Yeah, no, I agree. I learned so much from John and Felicia. It was so nice to sit down and just kind of talk it all out and talk it all through, because being that Maury is not something that Kenosha has ever had, we've had the Wisconsin PDO grant where we've done our Narcan training and distribution, which we're still doing now. But this is going to be a whole different initiative. So we do have really good community partnerships within Kenosha County. So now it's just kind of putting all those puzzle pieces together. So
great.
Figuring it out.
Great. Thank you so much. I just received a quick little message that's asking what is Maury, and Paige, I'm wondering if you could just real quickly, or Jennifer,
Sorry,
because
yeah.
I know we covered it, but just to make sure everybody knows what that is.
Yeah, Paige, go ahead. You want to take it over? That's fine.
Sure, absolutely. But feel free to jump in. So Maury is the Milwaukee Overdose Response Initiative. So that's overdose follow-up program where after a person might encounter or has a non-fatal overdose encounter with Milwaukee EMS, they're then connected to Maury. And so a follow-up team of medical providers and peer support specialists go try to make contact with the person to offer services and connection to treatment and harm reduction supplies.
So she emailed not all the pages back to us?
Oh, Larry doesn't. I'm going to mute Larry. So I got him muted. Go ahead. Sorry.
Well, that's all I was going to say. Feel free to expound upon that, Jennifer.
Yeah, that's really what I was, that was really all the information that I was given to from Greg Miller and Mike Wright. A lot of it came down to how do we put a sustainable program in place where we're the most effective. So that came down, a lot of the conversations that I had with them came down to making sure that we had qualified people, that, you do the interviews, you make sure that the right EMS people are the ones showing up to the doors, and how to get peer support specialists and recovery coaches onto your team, and contracting. I mean, it was a whole lot of like the behind the scenes of how we make this work. And just things like, how do you transport people if they say, yes, I want to go to treatment now or never? It's all these underlying questions of what if, and then once all those questions are answered, how do we put it all together? So they were a really great resource. So I definitely, if you haven't talked to them yet, thank them early and often. Their work is incredible. And it was a really valued conversation when looking from a ground level of trying to put a system like this in place. And just knowing what things I'm going to struggle with, when I try to put all this together. What are the challenges that I'm going to come across, and how can I overcome those challenges? So they are really wonderful.
Fantastic. Thanks, Jennifer. I keep going to the next step of what can we do as a community coalition. Felicia, I hate to put you on the spot, but do we have a data dashboard that we use as a coalition to measure our work, or is that something that this team should be considering?
You're thinking like how the progress of each action team, or are you thinking more about the resources that we're providing to the other?
I'm thinking more, how do we monitor what is going on in order to be able to help direct what we choose to do, to be more strategic. So are there certain indicators that we should be looking at, or is this something we should be talking about? What indicators should we be looking at in order to help us create more effective strategies to reduce overdose deaths and substance use?
Yeah, I mean, there are key markers and that we used for like the PDO grant, or that are out there that you can measure against and use those as benchmarks. We just have to identify which ones we want to do and which direction we want to do that towards.
And I am not, you're the data person. I'm not sure if that's the right way to approach it, but maybe our data and reporting team might consider some recommendations for what we might do and use in terms of a coalition moving forward. Any other thoughts for next steps?
There was one thing that I found super helpful actually this last week when I met with our medical examiner's office, is we have data reporting through our MEs, obviously, and she put together a really amazing heat map for our overdoses. And it was, you could just see where everything lit up, which was wonderful, because then we can use those areas, and it came down to blocks. So you could at least look to see, can we provide more Narcan training there? Can we do, like we said earlier, with the Narcan boxes? That's a great idea too. So I feel like the ME's data has, because it it is a little bit lagging, but I feel more current than a lot of data that I plan on using a lot of what we get from our ME to base best practice off of, especially when it comes down to location, as well as wards data. We do a lot with the wards data and navigating what our next steps are based on those EMS calls.
Jennifer, thank you. That's really helpful. So John asked, Paige and Sean, do you have any summary of which data sources are based on the location of an overdose versus the home zip code of the person who overdosed? For example, the state's suspected opioid overdose alerts are based on the home zip code of the person who overdosed, so it doesn't reflect if a bad batch was in a certain zip.
Yeah, that's a great question. So whenever you're looking at EMS data, obviously that'll be incident location. So that's a really good indication of that. Also for emergency department data, you can actually have it, you can either have it by the hospital facility location or the residence of the person. And so sometimes folks find facility location to be more useful because that might actually be reflective of folks who are in the area whose closest point of care would be that hospital rather than, whatever address is provided at the time of care. And so that's kind of a not perfect way to look at incident location, but can kind of be an approximation to still get more incident location information out of emergency department data. Also, I feel I didn't mention this earlier and I really should have, so I apologize. I'm sure you all already know this, but all health departments can have access to Essence. So if there isn't already that login and that data access in place, feel free to reach out and we can connect you to the folks at DHS to get you that login access. And then you can look every day at all of the emergency department information.
Fantastic. Are there any other questions for our presenters? I don't want to keep them if there's not. Paige and Sean, we know we're going to continue working with you. This isn't goodbye, but we'll definitely say thank you and express our sincere gratitude for the time you met with us twice to prepare for this, in addition to creating a fabulous resource presentation for us. Any final words before we all let you go?
I just wanted to comment on really our presentation and what we kind of learned from that. And I think you probably saw a little bit because there's been some comments, but really the importance of real-time or near real-time data, which is also the most challenging. And this is not unique to Waukesha County. The question is, how do you get there? And that's really where it becomes difficult. And that's always where the challenge is, because if you know real time, you can kind of respond in that fashion, close to real time. So I think that's going to continue to be a challenge. And yeah.
Great.
That is one takeaway, I think, from what you were saying.
Yeah, thank you. And Larry?
Is it just the nature of the investigations on deaths and autopsy that is the reason for that time lag? Is there anything that can be done to speed it up?
I think it really depends on where that data is coming from. So like non-fatals, like in Milwaukee County, most of them are responded to by EMS. So they own that data. So it's really up to them how they're going to share it. So that's really like when you talk about Maury and some of these other initiatives, since MFD owns that data, it's easy for them to do the 48-hour follow-up because they have that internal data.
That's exactly what we were talking about in Kenosha County, because so we have a good relationship with our Kenosha fire. So because we have one of the retired fire chiefs that's now in public health. So simply having that relationship is where we get all of those reports from. But from anybody else, we don't receive any data. Like we don't get those overdose reports that next day. We don't. So it's very difficult to try to I don't know, try to start that partnership with all of the other EMS so that they feel that, if they are to give you this data, are you going to do something about it? And what are you going to do about it? So that when that data sharing happens, they know that, they can entrust you with it. So that's something too that I've looked into as to how can we broaden that? We have one unit of EMS, and that's kind of where my conversation has come with a lot of our team members is it is easier for EMS because I don't get the phone call, EMS does.
Yep.
So how do we broaden that partnership to make a mobile response more integrated and actually in real time? So those challenges are the same challenges that we're facing in Kenosha to try to iron out. So
Right, and I
Thanks,
think the other
Jennifer.
way of looking at it as it relates to, let's say, Kenosha, is there's a more rural part of the county. That may be law enforcement as a primary first responder because of volunteer fire departments and things like that. So really, it's a little more difficult in counties like that. So Milwaukee, just looking at numbers, let's say MFD responds to 4,000 assignments and administers naloxone. Milwaukee Police Department might administer naloxone 100 times. So significant. So the police department is somewhat insignificant in the bigger picture, but in different counties that may be significant.
Yep.
Yeah.
Yep.
Yeah, we have a lot of our zip code that's west of the eye. So we tend to, well, a lot of our, city overdoses happen in the city. There's also other spots that are now on the heat map too that are westward. And for instance, I just went and gave a Narcan presentation to one of our volunteer fire departments out in the county, and they didn't even know that Narcan was available to them for the last 5 years. So they had been, purchasing it, and it got so expensive. So all of those kind of challenges that are all throughout the county, that just educating everybody in the county and all of, law enforcement, all of EMS, whether they're volunteer or not, to know that we have it available, it's here, we can do the trainings, and then what resources are also available for those folks that are out in the county too. So
Right.
definitely challenges.
Jennifer,
Yep, so
thank
in
you
that
so much
case-
for sharing.
I'll go ahead.
Nope, Sean.
So in those, it's important then that the law enforcement agencies in some of the more rural counties would have naloxone available, because even in Waukesha County, I live in Muskego, so I'm a Waukesha County resident. The police are going to show up before EMS for sure.
Right.
And they're EMTs, so that's an important piece of it. It's somewhat under-collected, really, when you think about it. So, like we talked to Michigan quite a bit about their SOS system, and they kind of have that, I guess, that black hole of information where they're not getting anything from law enforcement. When you start looking at rural areas, you're kind of missing part of the picture there.
You're 100%.
So again, like you said, it's really the relationship building is what's going to make a lot of this happen.
It is. I mean, I walked into, this county volunteer firefighters, and I was like, hey guys, we're going to do a Narcan training today. But it was funny because when I had called to make the, appointment to do so, it was very casual. It was not like an official. It's like, yeah, it's on Monday night, come see us. And so I show up, and then like everything had turned once I got there, and it was so nice. They were so welcoming, and just welcoming to the information that they didn't know was out there. So and I don't think, like, me being here for 5 weeks, obviously them not knowing that even Narcan was available for the last 5 years, it just makes me think who else was contacting or reaching out to these people just to have that conversation with their EMS coordinators, so it's all about making the phone calls.
Definitely.
Yep. And I don't know what we're doing here in our county. So you guys this team probably knows way more. I'm just the facilitator. So I will let you all head out and have your evening. Jennifer in Kenosha County, thank you for joining us. We look forward to continuing that partnership.
Yeah,
Paige
thank
and
you so much
Sean,
for the invite.
oh gosh, we're so glad to have you. And Paige and Sean will continue that partnership. If you have any other questions, you can reach out to Larry or Mary or me or Tristan, and we will direct you to the right area. And thank you all for being here today.